Searching for the HIV antigen is the first step to eradicating the virus. The most common technique is known as enzyme immunoassay, ELISA testing, in which bodily fluid, most commonly blood, is drawn from the patient and tested for the presence of HIV antibodies. ELISA testing is not reliable for infants or children under the age of 18 months because the presence of maternal HIV antibodies can result in a false positive.
The following is a protein known as 1E6J that is part of the antibody termed Fab for antigen binding fragment, bound to the viral capsid, which we detect through a simple color change when it binds to the HIV antigen or an added substrate. The reaction signal between the protein and the other substance is from covalent bonding. The best method to determine infection from HIV is through nucleic acid testing because it targets the genetic material that makes up the HIV virus rather than its antibodies, which proves to be more effective in the case of infants. NAT testing is started with the polymerase chain reaction, which we will demonstrate and explain. In the first stage, we select our target sequence of DNA within the sample strand through the help of several primers. The pink section indicates the HIV DNA sequence we intend to duplicate. During stage 2, we raise the temperature to 95 degrees so that the strand begins to separate. During stage 3, we decrease the temperature to around 60 degrees so that the polymerase begin to complete the separate strands. During stage 4, the target HIV sequence is doubled, thus giving us twice the amount of HIV DNA. This process is continued many times until millions of copies of HIV DNA are made for the detection of genetic material. The last part of NAT testing includes oligonucleotide probes, which are simply detectors that are set to match the DNA sequences of the HIV, as it scours the amplified DNA for presence of HIV. This effective testing method has a window period of 12 days. Thank you for watching our video, and we hope that you safely test the infant within your care for HIV. We'd also like to thank RCSB PDB for the opportunity to delve into such an important topic. Here are some of the sources we use for more information.